is called ductal carcinoma in situ. DCIS. It appears like a dot, and there it has not invaded the surrounding tissues, which means at that point it is easily eradicated if you are very observant. In the stage 1, the tumor, it gets 2 cm across, and yet not still affecting the lymph nodes. In the stage 2, it goes from that 2 cm across and started spreading to nearby nodes, lymph nodes, as to get to 2 to 5 cm across, and sometimes have not reached the lymph nodes, or it has reached it. In the stage 3, the tumor is up to 5 cm across, and it has spread to several lymph nodes, and the tumor is larger than 5 cm, has spread to lymph nodes completely. At 4, the cancer has spread to distant organs because it has reached 5 and now move to touch other organs of the body. Now from the breast, it can reach lungs and other organs. And when that happens, it will be evident in that organ, but it will not be called, for example, lung cancer. It is still breast cancer. And when it has started to spread as to reach the surrounding organs or tissues, it is in the process of metastasis, or we call it metastatic cancer, because it is an active cancer now. It is a cancer that somebody has, allowed to be a killer. Because this time around, you need some medications. And most times, these medications, it could be chemotherapy or mammography. All these things will be done for alleviating the pains or the symptoms, not for cure. Because the period of implementing cure has been violated. So you put, or you take note of that. I will stop there for breast cancer. Do we have questions in that direction before I go to cervical and come to prostate? Cervical cancer develops in women's cervix. And what is cervix? Cervix, is the opening that leads to the uterus from the vagina. infection is highly linked to human papilloma virus, HPV. Extremely common virus transmitted through sexual intercourse. That is the pure way it is being contacted. Symptoms or signs, the signs: abnormal vaginal bleeding, unusual discharge, painful sexual intercourse, pain in the pelvic area, and certain complications with their bowel movements. Others are vaginal bleeding after sex, vaginal bleeding after menopause, vaginal bleeding between periods, or periods that are heavy and longer than normal. Vaginal discharge that is watery and has a strong odor or that contains blood. All these mentioned are signs of cervical cancer or warnings of cervical cancer or symptoms of cervical cancer. It is corrective if treatment or report for that is embarked earlier. There are some types of that: squamous cell carcinoma and adenocarcinoma. Diagnosis: we have pap test. It can be used to observe or detect abnormal growth of cells in the cervix, or using biopsy and others, like CT scan, magnetic resonance imaging test, or scan. The treatment could be surgery, or radiation therapy, or chemotherapy. Chemotherapy is the use of chemicals to kill the cells, or to reduce or relieve the symptoms and the growth. Down to prostate. Prostate cancer is cancer that occurs in the prostate. You know, prostate is in every man. It is a major, a vital organ. And what is the functions or the major function of prostate? It is responsible for the production of seminal fluid. And when the seminal fluid is produced, it is stored in the seminal vesicle. It is stored there for use. The warning signs of prostate: difficulty in starting urination. You want to urinate, but it will take you a lot of time before you start urinating. Or you're already urinating, but the urination is weak and often interrupted the flow. Urinating in often, at a time you begin to think or suspect for diabetes, it's a prostate, especially at night. Another is trouble in emptying the bladder completely. After some time, you will return to urinate because the initials we are not completely emptied. It's a prostate sign. Or blood in the urine or in the semen. Or pain or burning during urination. On our phone or phone. Dysuria. On our phone. So the main cause of that is still the affection of the DNA. That's alteration in the DNA. Every cancer must have a touch at DNA before it is approved. Whether cervical, whether breast, or any other cancer, kidney, whatever cancer, it is alteration of the DNA. It is curative as long as you not allow it to destroy major tissues. And thank God that our brother Uzigwe has started that talk. So you have heard him. If you are waiting to get to chemotherapy or to get to surgery, it's not the best. And when you've allowed surgery to come in, your intercourse is gone. Every person have to be at rest. So at this juncture, I would still recommend for that kind of treatment, because our conventional drugs have no solution to this. What they can do is to help to alleviate pains or symptoms, but cure is zero. And with time, there will be a kind of incubation, until it gets to worst. So sometimes we use our homeopathic remedies for that too. The conventional has nothing to do for that. Now, where do this prostate cancer starts? It starts at the outer gland cells of the prostate. Outer gland cells of the prostate, not inside. It is outside of the prostate. And that is known as acina ade. Acina ade, I don't know, carcinoma. Factors that can increase the risk of prostate cancer. Old age. Yes, we have been told, one, that it is in every man. And it starts to give problem from the age 45 or 50, every man should begin to do tests or diagnose himself from the age of 40. From the age of 40, periodically, you do check-up. Or you embark on those herbs you mentioned. It will help to avoid it. Old age and race. It is said that it is more common and severe, among the blacks than other races. And family history. If a blood relative, such as parent, sibling, or child, has been diagnosed with prostate cancer, the risk may be increased. Also, if you have a family history or genes that are increased in the risk of breast cancer, or a very strong family history of breast cancer, your risk of prostate cancer may be higher. One negi or Maggie, whosoever that had breast cancer, and you are a man, you should take care to avoid prostate in your own direction. That shows that cancer is in that family. That is under family history. Obesity. People who are obese may have a higher risk of prostate cancer compared with people considered to have a healthy weight. Obesity. We have earlier talked about obesity. Kidney is responsible for waste management in the body. That your blood passes through the kidney for filtering of waste. And that is through the urethra. From the bladder, you have urethra. At the size of the urethra, at the top side of the urethra, very, very close to the bladder, is the position of the prostate. And when the prostate enlarges, it constricts the urethra, and thereby disturbing a good flow of urine. And at the same time, the sphincters, that's what we call sphincters, attached, in the bladder. This is from here it goes to the urethra, internal and external. When such happens, it affects the sphincters, the opening and the closing, and that makes urine that's supposed to flow fast to be retained. There be retention of urine. And when urine is retained, the tendency of some crystals, will be retained, and they then accumulate to form calculus or stones. When we say he has kidney stones. So that is still what the prostate caused. From cancer, it has brought in affection of the kidney. In the health awareness about this, It is said that at the age of 40 years and above, three things should be applied: information, reassurance, and plan for action. We are here gathering the information, creating the awareness. To know about the risk involved and know the symptoms and the screening and treatment option are under information. Reassurance address your emotions, anxiety, remove them. Your worriness about your problem, remove them. And then get yourself assured that you'll be okay. In the plan for action, develop a positive strategy for prostate health in the course of treatment, in the course of checkups, and that will help us. I will stop here. Any question?
Okay. Prostrate. Prostrate is a gland, and from age 45 it starts getting large, and it starts affecting your urine. Is there any other problem associated with prostrate outside of prostate cancer? Yeah, that's just the first question. Maybe I can follow it up after your answer. Is there a problem? Because generally it enlarges.